Okay, so welcome everybody to our final social exclusion seminar of this term and of 2022. My name's Laura Lane, I work here in CASE, and I've also got Cheryl helping us organise this, and Tammy, who is running the show online. Just as a few kind of bits of housekeeping for our online audience, if you could please try and remain muted during the presentation, which is being recorded. And then there'll be a copy of the audio recording available shortly afterwards. If you need anything to be clarified, please contact Tammy, who will make herself known to you all. The presentation is going to last about 45 minutes, and then we should have about 15 minutes for discussion. So just moving on now, today's speaker, we're very grateful to Dr. Jake Anders, who is joining us from the UCL Centre for Education, Policy and Equalising Opportunities, where he is an associate professor and the deputy director of that centre at University College London. He's also the principal investigator of COSMO, the COVID Social Mobility and Opportunity Study, which he's going to talk to us about today. Jake's research focuses on better understanding the causes and consequences of educational inequalities, evaluating policies and programmes aiming to reduce those inequalities. So I will hand over to you now, Jake, if that's
very much.
Okay.
Perfect, thank you. Slides is broadly what the previous one did, so I won't spend on it for long. Thank you so much for the invite to talk to you. This will be kind of a presentation in a few kind of different parts with some different purposes around COSMO and what we're trying to do with it. Introducing the study, what it's all about, and potentially how it might be useful to other people as well. Providing some of the initial wave one findings that we have from that, and then a little bit of a kind of deeper dive that we've started doing, looking at the take-up of catch-up tutoring among participants in the COSMO study. So COSMO was a brand new cohort study that was established in the middle of the pandemic. You know, when we were all trapped at home, a lot of people took up making bread or things like that. We decided to start a cohort study because, you know, we thought that would be fun. And you know, while not always fun, we do think it has been an important thing to do in order to help us track and understand into the medium and long term the effects, the unequal effects of the pandemic on young people who are part of a generation whose education has been particularly disrupted by it. Our kind of motivating research question, as it were, is this one in the middle of the slide here. How has COVID-19 pandemic affected socio-economic inequalities and life chances, short term and off into the medium and long term? Hopefully, we will get through those medium and long term. Obviously, that's slightly more dependent on our ability to continue getting funding to go back to these young people and talk to them. We've been doing this in partnership across CPO, our colleagues in the Centre for Longitudinal Study at UCL, and also the Sutton Trust as other major partners who've been an important driving force behind this as well, and obviously are great for helping us achieve policy impact from the work, which we think is a really important part of doing it. That's the group of us. Also featured there, UKRI as our funders for the work, and Kantar Public, who are the fieldwork, the main fieldwork partners. We're also partnered in kind of smaller ways with Department for Education, TASO, various others, to whom we're also incredibly grateful for the input they've given us through this process and trying to make sure that it is valuable for doing policy relevant as well as academic relevant analysis. So COSMO is a longitudinal study. It was not longitudinal yet, becoming longitudinal. It's got one wave so far, and the wave 2 fieldwork is underway and going pretty well, I'm pleased to say. But following a representative sample of young people who were in year 11, that's the year that young people take GCSEs or other same level qualifications in 2020, 2021. So they were in year 10 at the onset of the pandemic. They were the year who received teacher assessed grades without the threat of an algorithm looming over them in their GCSEs or other qualifications at that point. And our aim is to carry on following them through the remainder of their education and into the labour market. It consists of just over 13,000 young people across England in over 500 schools across England. And there is a disproportionate sampling of young people who are from harder to reach and disadvantaged and ethnic minority groups, given that aim of helping us to look at inequalities within the sample. Having deliberate oversampling of young people from those groups means it's possible to, without having too small sample sizes, look at inequalities that would not otherwise be possible. There's data collection for both young people and their main parent, the parent who sort of self-identified as being most involved in the person's upbringing and education. There was a plan to try and get some school questionnaires done as well, but that basically didn't work out because it turns out schools were really busy during the pandemic. Who knew? So COSMO Wave 1 has kind of a dual purpose in terms of being both the baseline of in some ways, general purpose cohort study. We've been trying to collect the kind of demographic, socio-economic, attitudinal questions that you would expect from a cohort study, but also with that additional information about the experiences that these young people had during the pandemic, so that we can link those demographic and socioeconomic factors to those experiences, understand in a large representative sample the correlations between those background characteristics and those experiences, and then how they are all part of a big sort of mediation to later outcomes in terms of their educational outcomes, their well-being and their transitions into the labour market. So this is also designed for some administrative linkages from the outset. 75%, just under, of young people who took part in Wave 1 consented for us to link their data up with National Pupil Database. Slightly lower rates for some other related linkage of HMRC and DWP data, in order that we can link COSMO up with what the government calls the longitudinal educational outcomes administrative data set, which in principle means even if we did not get any more funding to do any more data collection with this cohort ever again, we are able to look at their wage outcomes, for example, wage and employment outcomes off into the future using that administrative data.
Can I just check with you on that, Jake? So have you already linked that? Have you got permission to link it?
We have the consent to linkage from the young people, and we've engaged with sort of DFE and others in terms of doing it. No one is allowed to link anything to Leo yet, but we believe we are as well placed as anyone can be to be ready once that's allowed. So to a little more detail on some of those things, I've mentioned the sort of big areas that we've been looking at as part of Wave 1 there, those background and demographic characteristics, pandemic experiences, mental health and well-being, post-16 transition and educational aspirations and attitudes to education. Wherever possible, we've been trying to harmonise the items that we use, the data that we collect with other similar and recent cohort studies. The Millennium Cohort Study, as the name suggests, are young people who were born in about the year 2000, whereas ours were born in 2003-4-ish. So they are not that far apart in terms of years, but quite far apart in terms of their educational experiences because of the pandemic. And so they, along with the next steps LSYP cohorts, are kind of hopefully natural comparators that we will be planning to look at in terms of understanding how experiences during these periods were different for young people as a result of that pandemic disruption. As well as those kind of big national administrative linkages I mentioned, we're working on linkage to the National Tutoring Programme information, which is part of that sort of tutoring work that I will come on to towards the end of the presentation, because that's, we think, an interesting thing in terms of this was meant to be a big national programme that was intended to reach lots of young people across the country. Our preliminary findings suggest it didn't really reach a lot of people, albeit that it's in kind of the directions that we might hope. But we want to bolster sort of the self-report data that we've got with that administrative data if possible.
Can I just follow up on that point about consent? One of the issues is, okay, you can get consent from your sample. And the problem with MPD and some of these other is that they actually haven't given consent in the first place. I think it's one of the main issues, isn't it, with MPD, that there wasn't consent sought from young people. It's just their administrator that's in database. So in a sense, there is slightly problematic, isn't it, in linking, even if you get consent from your participant.
Yeah, I mean, hopefully, so at least as it were, among those who are aware and have been consented to this, we've told them what's there in the NPD and you know why it is we want to link up with it. I think from that, to that extent, we hope that it's appropriate, that at least for our sample, as it were, you know, compared to the ethics of analysing it more generally, which you know, have kind of different views on for those reasons that you give.
Yes.
But we're kind of upfront with them about what we plan to do with that. There's an information sheet and things, as well as just the question itself.
Yeah, and sorry to keep on this point, because we've got some interesting results I know to show us, but are people being given the opportunity to withdraw consent at a future date?
Yeah, they can withdraw consent at any point, other than obviously if we've already done analysis with it, we can't sort of retrospectively remove them from things we've published, but particularly as long as we remain a going concern, there's a Kantar helpline that they can ring and ask to be removed and so on.
Can I just ask, how important is the linkage? Presumably you can get the GCSE results from them, but you want to make sure they're right.
Well, yeah.
That sort of question, I don't know.
Yeah. I mean, their GCSE results are going to be weird because they were these teacher assessed grades. But you can ask self-report, and Millennium Cohort Study, for example, does self-reports. There are advantages and disadvantages to each. I know this firsthand at the moment because I'm trying to analyse the Millennium Cohort Study differential performance among private versus state school pupils. The big problem with the NPD data for that is that private school pupils do a lot of IGCSEs, and they are not reported in the NPD. However, it does look like that self-reports, young people don't report everything that would be considered by the government to be part of Attainment 8. So even among the state school pupils, it's sort of, the distribution is shifted to the left. So you've got a kind of a bit of a problem on both sides, arguably, but particularly if what your focus is state school pupils, the administrative data does give you that extra, and also, as I say, potentially longer term. It also gives you not just GCSEs but earlier attainment data. So you've got age 11 test scores, national curriculum tests to use as kind of baselines for analyses as well. I mentioned the kind of oversampling and stratification and kind of the aims from that. This was a web-first survey, albeit that it was pretty much a web survey because the face-to-face follow-up was significantly disrupted by the renewed COVID disruption last year. But nevertheless, we have over 13,000 participants in over 500 schools, and they do look really kind of promisingly representative of the cohort as a the population that we are seeking to represent once you take into account the oversampling that we've done. As I mentioned, we're in the middle of wave 2 field work. We've just completed the web. We're very nearly to completed the web phase of that, and are pretty much already at the kind of 75% of wave 1 participants taking part again, which we're really pleased with. I can see there are some questions coming in. If there are kind of clarification questions, it's helpful for me to technically do.
In sense that you paid people.
Sorry?
You paid them.
Yes.
Sorry.
So yeah, young people were offered a base incentivization of £10 to take part in the survey, with a higher rate for those who are from schools with higher proportions of disadvantaged pupils.
Jake, we've got a question online about questionnaire content, if we could ask it now. So Emily Tanner is asking, under post-16 transitions, did you capture anything on access to career, education opportunities, work experience, personal guidance, encounters with FE, apprenticeship, sixth form providers? Schools reported a bit of a drop-off, but not as much as we would expect, but we don't have student perspective on that.
Yeah, I don't remember the items line by line, but some of those things, yes, some of those things, no, is probably the honest answer about that. We have some questions in there about information, advice and guidance, and sort of where people have sought that out. I don't think sort of contact with FE providers, for example. We've got some things that were intended to be around kind of aspirations around vocational subjects. It's something that people have asked lots of aspiration/expectation questions about university in the past. We've wanted to broaden that a bit, and we have some questions in that space around plans to among those who are doing kind of vocational qualifications, what level are they aiming to move up to in those vocational qualifications, and those doing academic ones at the moment, are they looking to do some kind of vocational qualification as well? This gives a little bit of a timeline of their schooling. So we are surveying them wave 1 for the first time. It is kind of in that year after the year that is the most disrupted. We weren't kind of able to get this into the field quickly enough that it would be sort of in the jaws of doing some of this. We have done some earlier smaller scale work looking at some of this, but we hope that this was kind of as realistically early as we could get in to ask them about this. So this was coming soon after they were getting their teacher assessed grades, for example, and some of it is reflecting back on a year of disruption, but some of it's also reporting on a year that continued to have a lot of disruption in it. That wave 2 survey, as I mentioned, is going on at the moment, and will be completed ahead of them taking their A-levels. And if we want to be out of the field, significantly before that, given that they won't want to be bothered, likely, in the run-up to those. So having talked a bit about the survey, I'm going to come on to highlight some of the kind of findings that we've summarised as part of the initial reporting that we have done. There are 4 briefings that we've put out at the moment. We're working on 2 or 3 more, which should come out over the next couple of months. They're available online, cosmostudy.uk, and go into much more detail than I can go into here and now. So if you have interest in any of these particular topics, there's also going to be some stuff on health behaviours and health outcomes, on their assessment and attainment experiences, and one other, extracurricular activities during this period, which was something the DfE were particularly interested in. Then that's in the more to come pile, but so please keep an eye out for those. So to canter through some of those, how am I doing for time? Okay. Just to highlight a few of those findings that we've analysed and think seem kind of important in terms of thinking about the inequalities that are likely to stem from the experiences. Starting with right back to the start of the pandemic, as it were, those periods of full school closure, in-person closure anyway, for most pupils. We asked various questions about their experiences during that time. In some ways, this is kind of just indicative of some of the data that we have in there. On the left-hand side of this graphic is the proportions across different groups who reported having at least 3 sort of fully remote live online classes per school week during that first lockdown. During that first lockdown, we can see they were, so it was about 36% who reported getting this level of provision. By lockdown 3, which is the second lockdown in which schools being in person was disrupted, lockdown 2 obviously happened somewhere in the middle there, but didn't really affect in-person schooling in the same way. That had significantly increased to 62% of young people receiving that kind of level of live online provision. So it's significant. Oh, sorry.
They were answering this during the third lockdown, had to think back to lockdown 1, like a year and a half.
They were asking this. They were asked this after both of them. So it is all a retrospective thing, and that is an important kind of limitation of it. Yeah.
Did you pick up where some were actually in school? Did you pick up anything on that?
Yes, we yeah.
Because some were actually, because they're vulnerable or whatever they are.
Yeah, that was a separate question that was asked.
So were they said yes, we had online anyway? Sorry, I'm just wondering in this survey.
A lot of those
You know
who, a lot of those who attended in person, you know, the provision was concentrated online. So even if you attended school in person, what that often meant was that you went and sat in a classroom and joined an online lesson.
Yes,
You know, not unlike Tammy's doing next door. They are still asked about this kind of provision because it was still the way in which they were generally getting their things. You know, those who turned up weren't getting normal classes, unlike the rest of people, as it were. But there was significant inequalities in this stuff, as you can see. Even in the first lockdown, those who attended independent schools were more than twice as likely as those in state comprehensive to report that they were receiving this level of provision, 84% to 33%, and within the state sector, there was not a particularly big gradient or consistent gradient in lockdown 1. But what really shifted between lockdown 1 and lockdown 3 was the more advantaged state schools were able to kind of increase their level of this kind of provision and catch up with kind of what independent schools had been offering in lockdown 1 as well. While those with the more disadvantaged intakes, so these 5 groups, the bottom here are, we take the state comprehensive schools and split them by the proportion of their pupils who are eligible for free school meals. And those with the highest proportion of pupils from eligible for free school meals were more likely than in lockdown 1, but were still lagging sort of a long way behind in terms of this provision. Worth obviously pointing out that that's not likely to be for lack of trying. Those were schools that were facing a lot of other challenges that they were having to respond to, but it does show the extent of difference in provision between different sectors and different parts of the state sector as well. So during that period as well, what were the big barriers that were being faced by young people to learning? Lockdown 1, 34% of young people said that they weren't having any of these live lessons, and that had dropped considerably down to 13% by lockdown 3, although it's still perhaps a surprising level, given the focus on this is something we're going to try and make sure all schools are doing, that was being reported. There were some things that didn't particularly change between lockdowns, things like internet problems or the kind of confidence of your parent in supporting things that wouldn't be expected to particularly be able to change. But a lot of the other things were kind of being somewhat addressed. Young people were less likely to be having to use a shared device in order to join online learning, less likely to be having to use a mobile device in order to join online learning. There was more kind of a little bit more priority, it seems, to helping young people access additional sort of outside lesson time support from teachers. What didn't really shift, again, something there of those who had no device to join things, perhaps despite significant efforts to do that. There's a bit of an information dump of some of the other things as well, but just to summarise those points, there were those substantial gaps between state and private in intensity of remote learning during the first lockdown, but that had been kind of largely caught up by the more advantaged parts of the state sector by the third lockdown, but wasn't able to be matched by those from less advantaged state schools. And I highlighted the barriers to remote learning there as well, but it's perhaps unsurprising to learn that lack of access to suitable devices, lack of quiet space in the home, things like that were all more likely to be experienced by those from less advantaged backgrounds. Moving on to mental health and well-being. I realised on reflection, but I'd already sent the slides in, so I couldn't change them. The overall well-being is a terrible title for this. It's exactly the opposite of that. This is data that, as I say, one of the things we try to do is make sure that we are harmonised as much as we can be with other comparable cohorts. This is cross-cohort analysis of the next steps, which is LSYP1, young people who were born in 1991, I think that's right. The Our Future cohort, which was LSYP2, who were born 10 years later, and then our COSMO cohort. So they were, this was all measurement of their well-being using the GHQ12 battery at age 17 among all of these cohorts. And this is the percentage of young people whose responses suggest that they are at risk of kind of elevated psychological distress. There's maybe a sign of a slight uptick in cohort compared to the trends in big quotes, given that it is only 2 data points there, from next steps to Our Future. But really, to me, the increasing challenges around young people's mental health have at most been exacerbated by the pandemic, but realistically, they are mainly about a long-term trend and challenge in terms of young people's mental health and well-being, which suggests something much bigger and more systemic that needs to be addressed. This is even if that were to make it okay, right? It's not that the pandemic has done something terrible to young people's mental health and well-being, and it'll basically be okay again once the pandemic's gone away again. Rather, there's some big and systemic problem, which I think we knew to a certain extent, but it's a very sobering finding, in my view, that almost half of young people in our cohort are reporting in a way that suggests that they are facing challenges in this respect.
Yeah, just a quick question on that, because of the next steps in Our Future cohorts. Have you weighted the data there, the nationally representative? Because we know your sample isn't. You've oversampled disadvantaged groups.
Yeah, so all of them, the relevant survey design and non-response weights have been applied to try and make them as nationally representative as possible. So as far as we can say,
yes.
I mean,
so where did you get your weights from for the COSMO then?
So the weights for COSMO are based on that deliberate oversampling. So we know how much we oversampled those groups, so we're able to downweight those groups again in order to make sure that they're representative. You then also have obviously initial non-response to your survey, and but we know some things about the young people. We know who we invited, and we know who took part, and we have some information about them from the National People Database. So to the extent that you can predict non-response, which is not entirely, from their characteristics in the National People Database, this is as nationally representative as we can get.
You've done that for all the slides you've done today?
Yes, I should say that, yeah, everything is weighted and takes into account the survey design. But one thing that is important to say in terms of that mental health and well-being, I mentioned, as I say, I think that the biggest story in terms of that overall level is big systemic issues that are building up over time. That said, young people who experienced particular challenges that we might think would be predictive of poor well-being during the pandemic were more likely to come into that group. This is the same percentage, it's the percentage in that group of those at elevated risk of psychological distress. And those who didn't experience any of these issues listed here during the pandemic were considerably less likely to fall into that group. This is a very descriptive analysis at this point, and there's a whole bunch of reasons why people who experience some of these things are different from those who didn't experience any of them during the pandemic, but nevertheless is sort of a starting point for us wanting to try and look into and understand some of those things. I'm going to skip through that slide again there. It should just be a kind of summary of it. Then into the sort of slightly later phase of the pandemic, young people during that year 11, that kind of particularly disrupted year, the year that did include again a period of whole school closures, but this is focusing on the periods when when schools in general were open. Nevertheless, a lot of young people missed a significant sort of amount of time from school due to pandemic-related factors. I can't remember exactly how that was defined for this, but it's in the briefing notes if you want to check up on that. So 31% of young people had between 6 and 10 days, and 18% of young people had more than 20 days of their school, that they were told you need to go and work from home or just off school entirely as a result of things to do with the pandemic, such as bubble closures, as they were called, where particular groups had to go home because of a COVID case, or staff absence, or those sorts of factors. This was also a year in which there was this big effort to try and support young people to catch up with learning that it was concerned they had missed as a result of the pandemic disruption, including disruption that was still going on during that period, of course. The most common of these kind of catch-up provision that was offered was additional online classes, in addition to the classes that they were now getting back in person in the classroom. Almost half of young people told us that they had been offered additional online classes, and 30% of young people said that they had taken that up. So you will notice in all of these, there's a significant gap between the proportion who say they were offered some of this provision and those who took it up. 45% additional in-person classes on top of the kind of normal school load. This one I think is kind of particularly interesting. Well, I should do it with this one so that people at home can see what I'm pointing at. Extra tuition support in pairs or small groups, and extra one-to-one tuition and support. A third said that they were offered that small group tuition, of whom a fifth well, a fifth of the overall group reported that they'd taken that up, and 12% told us that they had had been offered but not taken up one-to-one tuition support, and 14% said that they had taken that up. I'm going to skip through that one again. It's all there on the side because I want to dig into that issue of tutoring just a little bit more. This focus on small group and one-to-one tutoring in particular has been an important part of the plan for how we were going to support young people to catch up from this education disruption due to COVID restrictions. Was, you know, a big national policy conversation. There were the big initiatives like the National Tutoring Programme that were intended to be supporting this and get that kind of provision to as many young people as possible, focusing as much as possible on young people for whom who needed it the most, basically. As this is very early stage, and I'm really interested in hearing people's takes on it and sort of things that they think we could helpfully be digging into and trying to understand as part of these analyses. We're just trying to dig into both who was offered, who told us that they were offered tutoring, and at this point we've conflated together that small group and one-to-one tutoring for the purposes of this analysis. Who was offered it and who took it up, conditional on having received that offer. So having lumped things together to a certain extent for this, the sort of percentages shift around a bit, and also things change a little bit, not too much, but a little bit as a result of having to restrict down to a smaller analysis sample for whom we've got the kind of background characteristics responded to that we want to use as part of this analysis. 26% of young people say that they received some form of either one-to-one or small group tutoring. That's out of 40% who said that they were offered some form of this kind of tutoring. So 65% of those who were offered this kind of tutoring took it up, and 35% didn't choose to take up that offer. In order to kind of unpack this, we've started out looking slightly as a kind of proof of concept in a way, looking at gender inequalities in this take up and so on, just as a starting point. We think there are other important things to look at, but these data are very new to us essentially, and we've not got through everything that we want to yet. But looking at that unconditionally and then conditioning for various other aspects of their demographics and experiences, just trying to understand some of those inequalities that remain. Among those who received tutoring, there's markedly little gender inequality in who received small group or one-to-one tutoring. What then becomes slightly more interesting is, at least unconditionally, girls were slightly less likely to be offered tutoring. So in this first column, this is purely the unconditional picture. Girls were almost 4 percentage points less likely to be offered tutoring. That attenuates somewhat, but sort of partly just because it loses precision a bit when we take into account their socio-economic status, and a bit more when we take into account differences in reported motivation of the young people, given that you might be more likely to be offering tutoring to young people who say that they've kind of lost some of their educational motivation as a result of the pandemic, for example. Increases a bit again, and is on the edge of, annoyingly on the edge of statistical significance, when you, in this column, we add in school fix effects. So as far as possible, we're trying to compare young people in sort of similar educational contexts. Girls just a bit less likely to be offered. Then the flip side of that, as makes sense from the fact that we don't see a pattern overall, girls were less likely to, girls were significantly, however, more likely to take up any offer of tutoring that they received. And that sort of seems to stand, and indeed, if anything, get a little bit larger when we take into account their SES, which doesn't make a big difference, unsurprisingly, you know, lots of boys and girls of all different socio-economic backgrounds, but also their motivation and the educational context that they're in by including those school fixed effects. I think I'm pretty much at the end of my time. So just to sum up, we hope you are as excited as we are about COSMO as a new resource. I should highlight that the data for COSMO are all available for anyone to download and use on the UK data service, and please do, because we think that there's a lot more to learn than the analyses that we're going to have a chance to do ourselves. There's these significant inequalities in young people's experiences as a result of the pandemic and subsequent catch-up efforts that need to be explored and are going to have long-term implications that we plan to, and we hope others will join us in trying to understand better. Thank you very much.